Our next speaker is Dr. HARSHA BHAMIDIPATI. She'll be talking on retinal transplant, a boon for retina. Query. Please start.
Good morning to everyone. My today's topic is renal transplant a boon for retina? This is my abstract. Aim of my study is to study course of the retinal changes in post-transplant cases for a better quality of life. Chronic kidney disease is an emerging health problem which has a substantial mortality and morbidity burden. As there is a structural and embryological similarity between the renal and retinal vasculature, the current study is proposed to evaluate the effect of improvement of the renal function post-renal transplant on retinopathic changes. This is an observational and prospective study. It was conducted in 72 diagnosed CKD cases, of which 56 cases were divided into two groups. 28 cases were diagnosed cases which underwent renal transplant, and 28 cases who didn't undergo renal transplant, which were matched for Agents X criteria. Study was done for a duration of 1.5 years. Each patient was observed for 3 visits at an interval of 6 months each for 1.5 years. Proper ocular examination and documentation was done in all patients. My study had a male is to female ratio of 2:6, of which 60% had both diabetes and hypertension. 27% had only hypertension, and 14% only diabetic patients. It was observed in a group with the CKD patients who underwent renal transplant that on the first visit 50% had diabetic retinopathy, 37.5% had hypertensive retinopathy, and 18% had other retinal findings, which was almost consistent in the further 2 visits. And it was noted in the group which didn't undergo renal transplant. On the first visit, 46% had diabetic retinopathy, 39% had hypertensive retinopathy, and 19% had other retinal findings. These are the graphs showing a comparison of the incidence of retinopathic changes in all the 3 visits, which shows that in patients who didn't undergo renal transplant, we saw an increase in the incidence of diabetic retinopathy in further visits, and also it was observed that the severity of the disease increased, staging of the disease increased, while it was bit stable in cases who underwent renal transplant. These are the fundus photo documentation done. Diabetic nephropathy is a leading cause of end-stage renal disease in patients aged more than 40 years. Hemodialysis, peritoneal dialysis, and renal transplant are some main modalities of treatment of such patients. In a study done by Rupak Roy et al., it was concluded that renal transplant had stabilized the retinopathy status in the majority of patients, although a minor subset of the disease course was unpredictable in few cases. Our study showed a similar stability in diabetic retinopathic cases in post-renal transplant patients. Study done by Chow and et al. Showed a stable visual acuity in follow-up period. Our study showed a stable documentation of the fundus changes in post-renal transplant cases, which was mainly in diabetic retinopathic cases. Another study done by Ramsey et al. Showed an immediate early worsening of diabetic retinopathy in immediate early post-transplant period. But however, such thing was not noticed in our study. My study concluded that post-renal transplant showed a stability in the progression of retinopathy as compared to those who didn't undergo transplant. This stability was particularly noticed in cases of diabetic retinopathy than hypertensive retinopathy. Visual acuity was not taken into consideration as it was affected because of cataract and other retinal findings. Our study was more strongly associated with diabetic retinopathy. Proper intervention in patients without renal transplant can also help in controlling progression of the disease. So regular ocular checkups must be done in patients without renal transplant so that we can intervene early for a better visual outcome. My take-home message of the study was that when a patient visits a nephrologist, a proper awareness must be created that with each visit of nephrologist should be corresponded with an ophthalmologist visit, so that he can undergo a proper ophthalmic examination and we can intervene early accordingly. These are my references. Thank you.